A couple came, they were Arabic, and the husband wanted to come in with his wife, but ahead of time I did talk to a tech. She let me know that men are not supposed to go behind the doorway to go to the room. So I would have to explain it to him. So he came in with her and I explained to him that he could wait in the waiting room or he could walk with me to the changing room on the side, but to see that I would be the only one taking her in. As soon as I brought her out, I said she'll be in good hands, she's gonna be with me. As soon as she's done, I'll take her, get her changed, and then she'll be right back to you. He was okay with it. She was happy about how we treated her, and then, yeah, when she was done, I told him everything came out okay, and he was happy about it. So everything went good.
I had a patient that had a cultural difference where her husband was a machista and did not let her do a mammogram because he was afraid that it was a male physician doing the mammogram, and we overcame that by finding a female physician to do the mammogram for her.
One of the ways that I was able to help a doctor understand culturally why this patient did not want to come in for her mammogram was that this patient was really afraid of immigration, of the situation that's happening right now with all of the immigration changes and the deportations. She was really afraid of coming in. And the doctor was like, well, we're a hospital. We don't have immigration services here. I says, I understand that. I says, but the patient has to travel to get here. After explaining the processes of what the patient had to go through and the patient's experience of coming to the United States, the doctor was a little more understanding and says, okay, then, it's okay to reschedule, or if she has to come at a special time, we'll make an effort for her.
Yes, I can tell you that there was a time where I had to talk to a physician about the cultural and social needs of one of my patients. And I can tell you a story, and it was about a young lady that could not afford her medication because of the cost. And then there was a second part to that, is that she had a health literacy challenge. And the first thing that I did was I called the doctor's office and told them that she could not afford it. And is there any way that they could go on the formulary and get a medication that Medicaid or Medicare would cover? And also that she had a health literacy problem. She did not understand well how the medication was being used and when she should take it and the dosaging. Even though I can explain to her that in plain language, but I wanted the doctor or his MA to take the time to explain the information to her and let her know that this medicine should be taken at this time and how to take the medicine. Just give her a little bit more time when they were instructing her on her medication and on the plan that the doctor had for her, because she did have a literacy problem. I can also help them reinforce those instructions. And it turned out really well, because after both of us, the doctor and his team and myself, started to be cohesive with each other, then she got control of her chronic disease.